Good morning. Today I am going to talk on emergencies in tuberculosis. It includes causes, pathophysiology, pathogenesis, pathology, management, prevention, and future prospect. Causes of emergencies in tuberculosis arise due to the complication or severe disease progression, including massive hemoptysis caused by erosion of blood vessel due to cavitary tuberculosis or bronchial artery hypertrophy. Tension pneumothorax, it is secondary to the rupture of cavitary lesion. Acute respiratory distress syndrome, which is called ARDS, resulting from miliary TB meningitis, increased cranial pressure or hydrocephalus could be the cause. Intestinal TB, there is a perforation, obstruction or massive bleeding. And in heart, pericardial TB, which causes cardiac tamponade from effusion or fluid accumulation. TB spine, which is also known as a Pott's disease, spinal cord compression leading to paralysis. And the last one is the sepsis and disseminated TB. It is due to immunosuppressed patients are at a risk of systemic infection. Pathophysiology. The pathophysiology of TB emergency stems from host immune response to Mycobacterium tuberculosis, or Mycobacterium tuberculosis triggers a granulomatous inflammatory response. Tissue destruction caused by tuberculosis resulting from caseous necrosis, which causes liquefaction and cavitation. Vascular involvement, erosion or aneurysm of vessel leading to hemoptysis or bleeding. Dissemination, it is called hematogenous spread or blood spread, result in biliary TB affecting multiple organs. Immune reconstitution inflammatory syndrome, which is also known as IRIS. It is an exaggerated immune response in HIV patient during TB treatment. Pathogenesis, primary infection of tuberculosis, that is Mycobacterium tuberculosis, enter through inhalation, that is airborne, and establish infection in alveoli. There is a granuloma formation due to macrophages, lymphocytes and cytokines which attempt to wall off the infection. Progression to active TB, it occurs in an immunocompromised or untreated patient. The granuloma breakdown leading to dissemination, and the complications of it are caseous necrosis, fibrosis, and calcification impair organ function and lead to emergency. As a pathology in the lung is caseating granuloma, cavitary lesion, fibrosis, bronchiectasis, and vascular erosion. In central nervous system or CNS, granulomas and leptomeningeal inflammation in TB, meningitis. GI tract, gastrointestinal, there is a ulceration, stricture and perforation. In pericardium, that is in heart, fibrinous exudate lead to effusion which causes constriction. In bones, vertebral dissection and paraspinal abscess in spinal tuberculosis. Now let us talk about management. Management of TB emergencies includes, one is a supportive care. We have to give oxygen therapy for respiratory distress, fluid resuscitation in sepsis or shock, ICU care for severe cases, and in medical care or medical therapy, anti-tuberculosis therapy initiated with first-line drugs like isoniazid, rifampicin, pyrazinamide and ethambutol. These are the HERZ